Finding a coronavirus test is not easy, and running those tests is proving to be taxing too. Good evening. I'm Samantha Jones.
And I'm Corey Stark. The surge in the virus is delivering new obstacles really by the hour. And News 4 is watching out for you and your safety. We have team coverage at 10 on the newest developments.
We begin with our Kim St. Ange, who's giving us our first look inside what's being done to run the test. And Kim, those labs are getting overwhelmed.
You can imagine, Sam, because at some of these urgent cares across the area, we have seen lines wrapped around the block. Right now, I'm at the SSM Health Urgent Care in Brentwood, and if you were to go here and get a COVID test or any other SSM Health clinic or hospital in the St. Louis metro, more than likely that sample would be sent to a lab in St. Charles. Tonight, I'm learning exactly what happens to your sample once it gets to the lab and asking how we exactly know it's accurate.
This is where it all begins.
This lab in St. Charles is where roughly 1,400 COVID-19 samples are tested every day.
So these are all COVID samples.
Keith Landeros manages this lab for the SSM Health System.
We're actually receiving about 500 to 600 more than we actually can test in one day.
Since March, this lab has processed over 130,000 coronavirus tests from across the St. Louis metro. Staff is pulling double shifts to keep up.
2 weeks ago, I could tell you by the time we received that test, that sample, it took about 12 hours. Now we're more like 36 hours because our volume has more than doubled in the last 2 weeks.
When samples arrive, they're prioritized based on the reason your doctor lists for you needing a COVID test. Then the samples are taken here to the biosafety cabinet. This is where a technician puts the test tubes into racks and prepares them to be tested.
The actual test itself, this is not a simple test that takes 15 or 20 minutes. It ranges from 2 hours to 8 hours.
The time can fluctuate depending on which of the machines it's tested in. Landero says the positivity rate in his lab over the last 7 days is about 24%, compared to June when he says that number was closer to 2%. We asked the clinical microbiologist who oversees the testing about public concern with false negatives or false positives.
We know that if we follow the instructions, the risk for false negatives and false positives is very low. But with any testing, if a patient's concerned about that result and feels it could be inaccurate, it's really important to follow up with their provider.
One of the questions we hear from some of you is, okay, let's just say I'm exposed. How soon should I go get tested to avoid possibly getting a false negative or a false positive result? Well, what we're hearing from Landeros tonight is he's saying there really isn't a sweet spot. The experts really don't know. They're still trying to figure that all out. So he's telling me tonight, if you are exposed, you really should only be getting tested for coronavirus if and when you start experiencing symptoms. Live in Brentwood, Kim St. Ange, News 4.